can zoom in on that a little bit. Let's see what we got to see. Oh, that's better, isn't it? Yay! I'll hold it open here. I think I've got it. Yes. Oh my goodness gracious. Watch these little stringy things. Aorta, tendoni. So what's this flappy thing? The valve. Name this chamber. Left ventricle. Name this chamber. Left atrium. It's north of the valve. It's the atrium. Name this valve. Any name for this valve. Mitral. Bicuspid. Left atrioventricular valve. So we've got a couple things identified there already, don't we?
See how thick the wall is
Yes.
of that chamber?
That thick
ventricle?
and that thick. What's the name of this little bumpy muscle that the chordae tendoni are attached to at this end? It's on your list probably. Papillary. Papillary muscle. Okay, let's start with the left atrium. We know that we've got some blood vessels leading into the left atrium. Name those blood vessels in general.
Vena cava.
Pulmonary veins. And you palpate around a little bit, and you carefully with your fingers, and I'm kind of going into the auricle there, and yes, I found the hole. And that would be, yes, we have fun doing this. I need blue gloves to do this. It'll show so much better. See my finger?
Do you want to blue? Do you want to
No. I guess let's try to root for next year, because
Okay.
that would have been so much more fun.
Yes, it would.
Okay.
Especially the crappy as the color is on its own.
Yes. So we have where one of the pulmonary vein is entering into the left atrium. Well, let's go back. We have the left ventricle. What big main blood vessel is the left ventricle pumping through? Aorta. How do we find the aorta? From this orientation, when we cut it this way, the aorta is underneath the valve here, so we can stick our finger. I'll see if it'll work underneath that valve. Push up, and yay! There it is again, right there. Tip my finger, I think I'm stuck. That's my aorta. Now I want to get a good look at that aorta because I want to see the aortic valve. And I want to see the entrance to the coronary artery. So in order to do that, we're going to, we've got a little trick that we can use. I'm getting an instrument that is blunt. I'm sticking the blunt end through the aorta, and it's coming out the other end. So you can see that, can't you? Or you could if it was oriented correctly. Now that I've got this hemostat stuck through there, I can cut down directly on that instrument, and I know I'm going into the lumen, but not out the other side. Going through the pulmonary artery. The thing wants to get away